I think one of the big mistakes we make in healthcare ethics courses is distinguishing between the clinical and the ethical. That's just wrong. Everything a clinician does is clinical. You're worried about delivery of healthcare to a patient, or sometimes in some professions we'd say a client. And each of the decisions that gets made has an ethics component to it, has some fundamental evaluative choice that has to be made about the right way to behave. At the same time, every one of those decisions has what you might call a clinical component, where clinical skills are critical. Also has a scientific component, where you have to get your facts right. You have to understand the effects of a medication. You have to know how to place an IV. But you also have to know ethically when it's right to put the IV in, and sometimes when it's the morally wrong thing to do. So there's an ethics component to every clinical choice. There's a scientific component. There's a technical, professional skills component. All of those get packaged together in every clinical interaction. I think it's a terrible mistake for a nurse to say, I remember last week we had an ethics decision to make, as if it didn't occur every day with every patient. Some of the ethical choices you make with a patient are pretty easy. They're so obvious you don't even have to stop and think about it, but it's still an ethical choice. When somebody says we had an ethics decision last week, what they really meant was we had an ethics decision that was so tough we had to stop and think for a while. And in a way, that's where a theory of medical ethics or healthcare ethics comes into play. It gives you a structure when you have to step back and not just work on your instincts. Think about the choices that you have in front of you.